Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, I am so happy to be able to talk to Dr. Ridgway. It's been a while. Good morning, Dr. Ridgway.
Morning, and welcome to the world.
Welcome to the world. Yes, your wonderful world. And we have really enjoyed your columns. They're unique. They're not something that someone would even ask their vet. Some of them are weird, I have to tell you, but I love them because they talk about things I had no idea were even important. And you, of course, you've been a vet for how long have you been a vet?
Over 50 years.
Is that all? You grew up being a vet. Well, that's what made you want to become a vet, by the way?
Oh, that's a long story.
It's okay. We have 30 minutes. Just get started.
Well, a friend of mine and I got together. We were working with the Boy Scouts, and we had to plan the membership for a year. And he said, I have to leave, and he left. And I looked around, and I thought, geez, I own a chair, a table, and a couch. Those were the sole things. That's what I owned. And I looked at his house. It was very nice. He had nice furniture and everything. And I said, I got to be a veterinarian.
And you had to love pets.
Yeah, that helps.
Right. Well,
but, the big thing is you got to really want to do veterinary medicine. You want to be able to. The frustration is, what does this animal have? And you have to have the knowledge to diagnose it. And then once you get it diagnosed, you got to be able to treat it. Make sure that you treat it right, because these pets become a member of the family. And these people are very, very conscious of what you're doing. So you try to do the best job. It'd be terrible if they showed up and you'd say, geez, I don't know what to do. They would never come back.
That's true. Dr. Ridgway, how has veterinary medicine changed from when you first started 50 years ago?
Oh, my gosh. Well, the first thing is that I think that the profession it's a female profession now. Over 50% of the veterinarians are ladies. I don't know if that's good or bad. It's just the way it is. And the other thing is that board certification in education, the level of knowledge of animal medicine has grown exponentially, and I think it's because of the requirement to be an internist. We have internists, we have cardiologists, we have gastroenterologists. That's all they do. They have people that just do bone surgery, orthopedics, and it's a different ballgame. A few years ago, you could be a veterinarian and give immunizations and be happy as a clam. Well, those days are gone forever. It's just really, and the diagnostic capability, each one of those machines, it costs several thousands of dollars, but people expect perfection, and the only thing you can do is to buy those machines. A tooth cleaning machine is like $15,000.
How did you clean the teeth before you had the machine?
Well, you scraped them with instruments, and we had a machine that would remove plaque and so forth. But now they got 4 or 5. They're just like the dentist, you have everything at your disposal to use to take care of pets. But people expect that. And so that's the challenge, to be able to provide the level of medicine that people expect. they don't like to pay the bill. But, that goes along with the territory.
Absolutely. I love what you're saying, because I was thinking I now go to a vet with my dog. My dog's back legs are not working, but he's been taken good care of with a lot of things. And they have not only a physical therapist, but a pool that the dogs go in for their, for the therapy. They are, and the particular veterinary clinic I go to in Boca Raton is the only one in the country that has a hyperbaric oxygen tank.
Yeah, isn't that amazing? But you know what? That doesn't grow on trees. You have to pay the price.
Oh, big time, but they charge a lot too. So I'm glad that we're talking about this. I know you're probably going to tell us something. We're going to talk about something else. We never decide what we're going to talk about because you're so interesting. I can almost ask you anything and you just respond. But I want to continue with this because my dog had pancreatitis. I guess pancreatitis.
That's right.
Yeah, and of course, immediately was put on a different food regimen and gave some medication, and that took care of it. And then when he had a diarrhea, next thing he some medication, and that took care of it. And it is, and because his legs don't work, I purchased a I call it a wheelchair, but you've probably seen them, the wheels and the...
Yeah, they put on it,
Right. And I mean, but I guess my big question is, are pets living longer with all the increased accoutrements? Are they, and all the better medicine, are they living longer?
Absolutely. Yeah, sure. If you take care of them, they're going to live longer. It's just, years ago, we never paid any attention to teeth. And if you have good, healthy teeth, that helps extend the life of the pet.
Why is that?
Well, good health is the major thing. And if you have dirty teeth, you have bacteria and so forth in the gums, and they can break loose and get into the body and get into the heart and cause problems on the heart valves, and so you don't want that. So it's an important. Every system in the body needs to be healthy. It don't make any difference what it is. You need, whether it's urinary, GI, or lungs, or the heart, or whatever. It's got to function properly, and it's just like you and I. We want our heart to work well, don't want it to leak, and it's just the way it is. It's a modern medicine. A few years ago, I said my wife had her hips replaced. A few years ago, she just had to suffer with the pain. But with modern medicine they're in, they put in new hip joints, and she's walking without any assistance. She was using a cane, and now she's not using a cane. It's just wonderful. And that's called modern medicine. And, we pay the price, but you want it fixed. So. And
they do that on pets, too, now. I know that's true. And this particular veterinary clinic is known for that. I mean, it is amazing. But following through what you're saying, so I've noticed something, that when regular doctors have some treatments that are not paid for by Medicare, people complain. I don't want to do that. You don't take insurance. But I've been to the vet enough that, let me tell you, they charge you $400, $600. They give you the credit card, and that's it. Isn't it amazing that they will take care of their pets like that, but their own body, they don't do it if it's not paid for?
I don't have an answer for that.
I know. It's just like, it's wonderful because people love their pets.
Yeah,
and that's what they have to do. And it is amazing how people, I'll tell you what I would like to talk to you about this. Years ago, if you wanted to go get a pet from the Humane Society, you went and got it. Now, adoption papers, they have to come to your house to check you out. What's happened there? Isn't that amazing?
Well, it's because some people who have adopted pets have treated them very bad, and they don't want that to happen. So they have to check it out.
I mean, it's pretty serious stuff too. There are people. There's one dog that was so cute, and they had a waiting list for this dog, and they gave it to the person they felt was the very best pet owner. I love it. I love it. It's just so many things have changed in the whole veterinary medicine. I know that you are now retired, are you not?
I have been for about 5 years.
Right, but I
have forgotten so much that it's pathetic. I've had some people call and want me to go back to work, and you need to get somebody that's more up to date than I am.
Well, that means
I'm a victim of a system. I graduated in 1971. That's a couple of years ago. And I talked with a classmate of mine. He's retired now, but he said, before he retired, he says, I'm doing the same things that they taught us way back in 1971. And I understand that. That's what he knows. And, it depends on the level of education. It takes 4 years to get through veterinary college. And then you do a lot of people do an internship, and that's a year, maybe 2. And then a residency, which is 2 or 3 years. So they've got close to 10 years, and they haven't made a nickel. That's the way life is, You have to get qualified to do your job, and you want to do the best job possible.
And so you were a very good veterinarian, though. I mean, you took the time and you enjoyed what you did. And so how long did you actually practice?
50-some years. I don't know the exact number. It is a long time. The last 10 years, I can tell you that I did soft tissue surgery, mostly spays. Every day I did between 20 and 30 spays every day. That's a lot.
Were you tired at the end? Were you tired at the end of the day?
Well, not that tired. That's a lot of surgery in a day, and you have the field of technicians. Before they didn't have technicians. Now we have very well qualified technicians, and they have to have a certain level of education too. So it's a never-ending thing. People expect certain things, if you expect certain things, it costs money to get the equipment to be able to diagnose it. So that's the way it is.
You said something that was interesting about females now being vets. And, of course, that happened in all fields, whether it was in law or medicine, that women just weren't, they weren't accepted to do what men were doing. But now, in all fields, of course, and it's good, women get to do the same thing if they're capable.
They're very capable. There's no doubt about that.
Right. But, I guess what I was thinking is maybe because vets many, many years ago, they dealt with animals, large animals, horses and things, and maybe women weren't strong enough to deal with it. You think that was one of the reasons, too?
Well, that's a problem now. The ladies like to do small animal, and very few do large animal. And so a lot of the areas, they don't have a large animal veterinarian. And that's a problem. That's a problem in the field. I mean, I guess that should be expected, but that's an issue.
Yeah, I'm sure it is. And You know, the other thing is animal rights. Everything has changed. So, and to the best for me, because I want to tell you something that I heard. I heard it on NPR, and I mean, as a veterinarian, I'm sure you didn't deal with birds very often, did you? Little birds?
I had birds, yeah, but
did?
The reality is, what's a budgie? That's a parakeet. What's it cost? $10, $12? And they bring it in, and the first thing they have is a $50 or $60 bill, and it's expensive to treat a bird, but it's a pet, and people want to take care of it. So
yeah, right. Well, I heard a terrible story on NPR the other day, though. Songbirds are beautiful, and apparently you have people who want to capture them, sell them, all these things that people shouldn't be doing with animals. And in order to capture them, they had to use these decoys and different things that were absolutely terrible. And the birds, they invisible nets, they catch the birds, and then the birds that they didn't want, they just let on the ground, and the animals went and got them. I mean, it's so, you wonder how people can be so inhumane. I'm sure you saw it as a vet when people brought dogs or cats in and they had been mistreated. It kind of breaks your heart, doesn't it?
You need to be around the shelter and you'll see how terrible people treat pets.
Amazing.
I mean, it's pathetic.
Let me ask you, just put your psychological hat on. If they do that to a pet, do they do that to other people too? Their own families, or is that something separate?
Unfortunately, sometimes that's true. But on the other hand, some people aren't crazy, and so they don't do that. But, everybody has their own thing, and some people, it's a reflection of how they treat others, I think.
Yeah.
And now that's not a 100%, but that's definitely a part of it.
Right.
So,
and
this can be a reflection of the personality of the people that are involved.
Mm-hmm.
That's for sure. But that's not 100% because some people hate animals and others don't.
Yeah. Well, I'll tell you, there's another subject and I know you're going to love this one, therapy dogs. It used to be that, of course, if someone were blind, then, they would get, a seeing eye dog. But now the biggest thing is therapy dogs because you want to be able to take them everywhere with you, which was not allowed before. So, and then there are condominiums that never allowed dogs or pets. And now they have to do that because the doctor gives a person a letter that says it's a therapy dog. This is a whole new thing.
Yeah, I know.
Don't you love it?
It's true. The biggest thing that for me, I'm a retired Army guy, so I see therapy dogs used for military personnel, and there's nothing else that does what a pet will do. And so I'm all for it.
Yeah, I am too. It's great. And we have a real estate broker who's really fantastic, and he was telling us that some of the people that wanted to buy in a condo, that condominium association said, you have a pet. Well, he went and really figured out a lot of things and fought them, and then he started writing columns about what to do if you want to get your dog into a condominium. And, I mean, it is a whole new world, too. But you see, as I said, I have this wonderful Shih Tzu, Charlie, who's now about 14 years old, and he has Cushing's disease, but it caused his legs not to work in the back. But he is wonderful. In fact, he's sitting here with me now. He comes with me. I bring him in a little stroller. And, I mean, that dog is so meaningful to me, and he knows it, and I know it. I mean, we are such friends and such buddies, and I just, I don't know. It's a wonderful feeling to have a dog. And do you have pets yourself now?
We have a cat.
Cat. Yeah, I have friends who have cats, and the cats are so attached to them that they don't even want to go on a trip because the cat would just go to pieces.
I'm not that.
You're not that crazy, right? Yeah. Well, it's been a great thing that you have had this terrific career for so long, and I'm sure some people are so dedicated to you and appreciate what you did, and because they love their pets, and you relieve them. Now, the times when it is tough is when you see that the dog just is in pain or the cat's in pain, and you have to decide that it's just not fair to keep them living. That's the worst part for you, isn't it, as a vet?
Well, that's part of the game, and you can't get wrapped around the axle in the emotion things, but that sometimes it's very hard to try and stay separated, but you have to do what you have to do.
Right. And actually, I was thinking about this the other day, and since I have you on the radio, I'm just going to ask you. Charlie is really very important to me, but let's say that one morning I wake up and he dies in his sleep.
Uh-huh.
What would I do? What should I do at that point?
You have different options. I think the best thing you do is you take it to your veterinarian and let them take care of it for you.
In other words, you wrap him up in a towel and then take him. Is that what you would do?
I would. Yeah, that's what I did.
Oh, okay. I didn't know, and it's funny even to think about it, but I wouldn't know what to do. And people listening, this is a good thing. So you wrap it up and you put it in a towel or put it in a big plastic bag, I guess, or whatever, and you take it to the veterinary clinic, and then they take care of it, right?
They'll take care of it for you. Yep.
Yeah, that's okay. I mean, besides all the tears and all, but it seems like a simple question, but you haven't done it. I've never had to do that.
Yeah. Well, life happens.
Yeah, I know it does. Okay, so let's go on with some of the things that you have been writing really good columns. I must say they're unusual, and you must do research to get some of these things, in writing, because people, let's say you have a dog and you have no idea about some of the things that, well, for instance, Cushing's disease. I didn't know what that was, and people suffer from it too, and then there's medication that goes with it, and there are a lot of natural things now. You know about the CBD oil for pets. Seems like it's really working. Have you gotten into that at all?
Oh, I had a lot of Cushing's disease when I was in residency.
Oh.
Yep.
And what?
It seemed like I had an overabundance of it. Yeah, I had lots of it.
Well, do you know?
For some reason, I think it's a regional thing. You go to one area, and you have internal parasites. You go to another one, and you have Cushing's disease, and you go. To
Really?
It seems to be a regional issue.
Strange, isn't it?
Different diseases.
I wonder why.
I don't know. It takes some study to come up with the answer for that.
Well, now, I don't think this was around when you were practicing, if you haven't done it for 5 years, but the latest thing is CBD oil, the hemp oil, that are really relieving pets, horses, dogs, cats, of pain and making them much better. Are you aware of any of this?
No, this is post my time, and I haven't. Another thing is veterinarians have taken on is bees, and I don't know anything about bees.
What about bees? Oh, you're right that bees.
Well,
yeah. What? Tell us what you know.
Well, the bees they get disease like any other thing, and bees are a food-producing insect, and being it's food, they put it under the purview of the veterinarian. And the reason is that beekeepers were using antibiotics discriminately. And so to put some kind of a control on it and to protect the public from antibiotics, they decided that they'd make the veterinarian the one, and so they dispense the medicine for bees. Sounds crazy, but that's the way it works.
Huh.
You know another thing, have you ever been bitten by a mosquito?
Yes, of course.
Well, this sounds really stupid, but it works. If you take a fresh banana and the peeling and rub it onto the mosquito bite, depending on how much injection you have, you might have to treat it more than once, but normally the first time I did it, the mosquito bite was completely gone the next day.
No kidding. Well, that's good. Thank you. That's a nice little tidbit before we say goodbye. Gee, that was absolutely wonderful. A fresh banana peel, rub it on the mosquito bite, and it'll stop itching?
Well, it does for me. In less than 10 minutes, the itching has stopped.
Great.
And sometimes I went to a meeting and I walked outside and a whole platoon of mosquitoes greeted me as I walked out.
Huh.
I had to walk to my car and they were buzzing me, and I had got bites on the legs and hands and arms. So I got home and I peeled a banana and I started wiping, and well, half of them was gone the next day. And some of them, you have to rub them 2 or 3 times. I'm not sure why. And what I don't know is what's in the banana peeling that affects the mosquito bite. I can't answer that either.
Well, you know what? I use Siri from my iPhone a lot. I'm going to ask her later. What about that? She might know. She'll probably say, I don't know that answer, but I'm going to ask anyway. Well, Dr. Ridgway, thank you. You've just been terrific this morning. You're the only vet I really have on my radio show, and I love talking to you. You've been very kind, and you write very good articles, and I hope that you're enjoying your retirement, and just take care of yourself, okay?
Yeah. I try to do the best I can.
Good. Take care of your wife, too.
Yeah. We're hanging in there.
Good. Well, thank you.
Every day we're a day older, you know.
I know, but a day better. So thank you very much, and hopefully we'll continue to get your columns and enjoy all the information you give us.
All right.
Thank
Hang in
you.
there.
Thank you very much for your participation.